Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting this show from the studio, and our guest will be joining us remotely via video conferencing. New Jersey is in the midst of the fourth wave of the COVID-19 pandemic, with the Delta variant leading to a steady rise in new cases and hospitalizations across the state. About 5.4 million residents have been vaccinated to date, and some of the most vulnerable are starting to get booster shots. During today's show, we will discuss more about the Delta variant and the importance of vaccination with our special guest, Dr. Ronald Nahass, an infectious disease specialist who's the hospital epidemiologist at Robert Wood Johnson University Hospital, Somerset. Welcome to the show. Thank you, Dr. Nahass, for being here. For the studio and audience itself, can you just tell us a little bit about yourself, and then we'll get into the topic on hand.
Sure. Thank you for having me. I am an infectious disease doctor by training, and I'm the hospital epidemiologist at Robert Wood Johnson Somerset. Means that I am intimately involved on a day-to-day basis in dealing with the COVID response of that hospital and the staff that we've been dealing with over the last 18 months.
So tell us in a little synopsis of where we are with COVID, how we got to this point.
Yeah, it's been an unanticipated journey for sure. I don't think any of us have done a really good job at predicting how this pandemic was going to go. At this particular point, we're in the middle of what most of us are describing as the fourth wave of COVID. The first wave was the awful experience that we had when it first hit our state and our region back in March, April, May. The second wave began sometime in October to November and continued probably through sometime February, March, at which time we again sort of dipped down. And then shortly after that, after the governor started to open up our communities, we started to experience our third wave. And that wave was a little bit different. It was affected by the deployment of the vaccines that began in December, January, and were effectively deployed in many of the nursing homes and the older citizens in the state. And so that third wave involved more younger individuals. In fact, at the hospital, we tallied that and noted that the patients being admitted were about 5 to 7 years younger than what had been seen in the first two waves. And then that wave passed, and we came down, and everybody was anticipating the great reopening of the summer. But lo and behold, Delta variant surfaced, and that began our fourth wave, if you will, both in the country and here in New Jersey. Certainly, the south of the United States has been more greatly affected at this point, I would point out, by the Delta wave, with dramatic increases to levels really not seen in that region at all through the pandemic. Here in New Jersey, our fourth wave with Delta is about half of the size of the winter wave that we experienced pre-vaccine in this state. So right now, we're in the middle of our fourth wave. I don't know that we've topped out yet. I am concerned that we've not topped out on the fourth wave with Delta, but that remains to be seen. As I've always said, the virus is in control. We've not done a great job at predicting what's going to happen.
The virus is pretty smart. Tell us about the COVID virus itself and how variants develop.
It is smart. I always say viruses and germs were here before humans. They'll continue to be here long after maybe we're all gone. But one of the things a number of the things that are unique about this virus are worth mentioning. The first is that it's part of a large family of viruses called coronaviruses. And coronaviruses are well known to humans, maybe not by name, but certainly by the illness that they cause. coronaviruses are well-known causes of the common cold, one of the viruses that do that. So forever and ever, we've all experienced coronavirus infections as common colds, minor nuisances, last 5, 7, 10 days and go away, generally with no long-term consequences. However, there are some coronaviruses that can cause pretty serious illness, and 2 of which we knew about before the current coronavirus were the SARS-1 virus and the MERS virus, both of which cause very serious illness in humans, high death rates, but both have kind of petered out and went away. They were seen in the early 2000s. And then last year, we became very intimately familiar with SARS-CoV-2, or the novel coronavirus, which is the virus that is causing the current pandemic. And this virus is very much different than the viruses that cause the common cold, in that not only is it highly transmissible, meaning it goes from person to person very easily. It's frankly, at this particular point, one of the most transmissible viruses that we know of, just shy of the transmissibility of measles, for example. So highly transmissible. It also is a virus that has a great impact relative to the severity of disease we can get. So we see lots and lots of people that get very ill, needing ICU care, at great risk of death, or in fact, succumbing to this disease. So for example, here in New Jersey, we've had now over 1 million people who've had SARS-CoV-2, the novel corona infection. Of those, 26,000 people have passed on because of this virus. This is an unprecedented severity of illness relative to the COVID or coronavirus. And the third point I would make is the issue of its ability to change its coat, mutate. It develops these so-called variants that are in the news, in which it goes from, variant A to variant V to variant C. The way I'm characterizing it, make it easy, if you will, the first wave was really a wave of the ancestral strain or the ancestral variant. The second and third wave were waves that were predominantly the alpha variant. It used to be known as the UK variant, started in the United Kingdom. And the fourth wave, the wave we're in now, is being caused by the Delta variant. And so each time the virus mutates, it has an opportunity to affect us more efficiently. I describe it as a hunter. The virus is hunting humans, and the virus mutates to make it a more effective hunter. And in particular, the feature of the virus that makes it more effective is its transmissibility. So if you look at sequentially what's happened with the virus and its mutations, it went from the ancestral strain to the alpha strain to the Delta variant, each time becoming more transmissible and therefore becoming a better hunter of humans. And we're seeing that. And that's really what we're experiencing.
So things that we as humans need to do to help prevent the spread of the COVID-19. The first thing is, of course, the vaccines, the importance of the vaccines. So can you tell us a little bit about the vaccines? We know there are 3 types. There's the Pfizer, Moderna, which are very similar, just they are made by different companies, slightly different amounts of the ingredients, and then the J&J.
Right. So, protecting ourselves and our communities, our families from SARS-CoV-2 or COVID is really all of our primary goals, both as healthcare providers, family members, community members. And you really did, you hit the nail on the head, so to speak. The most important thing that we can do, the most important, is vaccination. And in the United States, we're fortunate that we have 3 different vaccines made by 3 different manufacturers. The Moderna vaccine and the Pfizer vaccines are what's called mRNA vaccines. And the J&J vaccine made by Janssen, a subsidiary of J&J, is a viral vectored vaccine. In the United Kingdom and worldwide, there are many other vaccines. There's another viral vector vaccine that folks may be familiar with called the AstraZeneca vaccine. That's also a viral vector vaccine that's commonly deployed in England. And then there are actually a fair number of other vaccines that are widely deployed across the globe. The one from Russia is called the Sputnik vaccine. And then there are two that come from China that are being deployed widely, among others. And so we have lots of vaccines worldwide, close to almost 2 billion, not quite 2 billion people worldwide have been vaccinated. That's really quite extraordinary in and of itself. Here in the United States, about 200 million individuals have been vaccinated. The bulk of those people that have been vaccinated are those individuals over 18. When you look at people, in fact, over 65, almost 94% of the population over 65 have actually been vaccinated, which is really, again, pretty extraordinary given the timelines of when the vaccine became available, deployment of it, and the process just engaged in doing the vaccination process. So vaccinating individuals is really the primary goal of treatment. The problems with the vaccine that have led to some of the challenges are that it's not yet approved for under 12 years old. So we have a large block of the population here in the United States, about 1.1 million individuals that are under 12 that are not eligible to get the vaccine. We also have a fairly large block in the 12 to 18-year-old group because the vaccine was approved later for that age group that have not received the vaccine. So their rate of vaccination is not quite 50% yet. And so that's a hole. So we have large blocks of individuals who are not vaccinated, which is allowing the vaccine to be disseminated pretty broadly still here in the United States and in New Jersey. So we have other means that we need to think about to protect ourselves. So what are those other means? It's the same tools that we heard before the vaccine. So it is about, wearing a mask, watching your space. And when I talk about watching space, one of the things that most people quickly jump to is distance. But when I speak to watching your space, I'm really talking about a bunch of things within the environment around you. So for example, is the space you're going into crowded? Is the space you're going into indoors or outdoors? If it's outdoors, is it a space that's a tent that has sides? Well, that's not really outdoors. So watching space has a bunch of things that you need to include when you think about space. It's not simply just distance. Distance is important, but it's also the environment of your space that's critical. When you're home, stay sick. When you're sick, stay home. That's really important. I can't tell you how often that we have staff members or I've had family members who I got a little scratchy nose or I just don't feel right and they go to work or they go to an event. That's a no-no, particularly if you're vaccinated.
If you're unvaccinated.
What's that?
Particularly if you're unvaccinated.
Particularly if you're vaccinated or unvaccinated, because the vaccine doesn't work 100% of the time. And what it does do really well is it keeps you from getting seriously ill. So that mild scratchy throat or itchy nose, if you're vaccinated, could be mild COVID because you're vaccinated. It did its job, but it doesn't mean you should go out. And so in the middle of a pandemic, we have to respect the fact that mild disease, mild symptoms may actually be COVID when you're vaccinated. So when you're sick, stay home, vaccinated or unvaccinated. And then, we talk about washing your hands, and that's really important regardless of the circumstances. So the 4 W's always apply.
So the most important thing, again, still is the vaccines. 1, 2, 3, 4, and 5, and get yourself vaccinated. The vaccines are safe, effective, and will keep you out of the hospital and avoid you becoming severely ill from the infection. They won't stop it 100%, and that's how we can get these breakthrough infections. The breakthrough infections occur, but can you tell us a little bit about the breakthrough infection?
Yeah, absolutely. The breakthrough infections are not a failure of the vaccine. It's really important to understand that because in the context of thinking about getting vaccinated, a lot of folks say, well, it's not so effective. I've got to wear a mask. What's the point? The point is that the vaccine is actually highly effective in preventing you from dying. That's a really critical statement. Today on rounds in the hospital, I saw 2 people under 50 in the ICU. We're very worried about them. They may succumb to this. It's happening still, and they're unvaccinated. It is unusual for us to see people in the hospital who are vaccinated, who have breakthrough cases, who are in the ICU. It just doesn't happen. So what is a breakthrough case? It means that the vaccine allows you to get infected but not sick. So the vaccine works for Delta because remember I described Delta as a hunter. It's become a more effective hunter because it's more transmissible. A lot of reasons why that is. But being more transmissible means that even if you're vaccinated, you may be more likely to get infected than with the ancestral strain. You're not going to get sick and die, but you still could get infected. That's a breakthrough case. It works about 80% of the time, let's say. Use that number as a round number, easy number to calculate, to prevent infection. But 20% of people who get vaccinated may still get infected. There are about 6 million people in New Jersey that are vaccinated. Take 20% of 6 million, that's 1.2 million people who could get infected. They can still potentially transmit it. They won't get very sick. They're not likely to die unless they have extenuating circumstances, but they could still transmit it. That's a breakthrough case. It's a numbers game. We've been so good at vaccinating. The vaccine works really well, but 20% of the time it's not going to work. That's still a good vaccine. But we got so many people that are vaccinated and we're still in the middle of a pandemic. So some people who are vaccinated are going to get an infection. They'll be mildly affected, but they could transmit it to the 1.5 to 2 million New Jerseyans who not yet vaccinated. There is the problem. We need to get everybody vaccinated.
So again, the vaccines are the most important thing for us, and they are all very safe vaccines. There is always going to be someone who has some type of a reaction, but a reaction is a lot better than ending up in the ICU on a ventilator and possibly dying from this disease.
Absolutely. The safety is an important point. And when we look at safety of the vaccine, the way that I try to help folks think about this or think through it, remember I already said there's about 6 million, 5.8 million people in New Jersey vaccinated. The COVID medical team has yet to see a patient who's been vaccinated end up in the ICU and die from the vaccine. We don't see that happen. It doesn't occur. But we see people every day, day in and day out, in the ICU near death from the disease. So we are not seeing hundreds of patients come to the hospital after the vaccine because they're sick, ill, or near death. But yet we're still seeing, even though the population is smaller that is unvaccinated, we're still seeing tens, hundreds of people come to the hospital with COVID. Huge difference. 0 from the vaccine coming to the hospital, hundreds coming to the hospital from COVID. That alone speaks volumes about the safety of the vaccine. But even beyond that, if you look at, but there are a bunch of examples of it, but if you look at just a number of them, within the context of the pregnant individuals, people who've had Guillain-Barré, and people who've had blood clots, 3 areas that are high profile. They seem to make a lot of news about the vaccine and the risks of the vaccine in those groups of people. They've actually been pretty well studied now and reported on a lot. And what we constantly see, consistently, study after study, is that those individuals, just in those 3 groups, I use them as an example, there are others, is that getting COVID in that group is overwhelmingly, hands down, far worse than anything that'll happen as a result of the vaccine. you would not want to roll the dice if you were those three risk groups potentially and say, I'll take my chances with COVID rather than take my chances with the vaccine. And that applies across the board for almost every other subgroup that you might want to think about. But those three in particular have high profile examples and lots of discussions. And so I would say again and again that the safety is very clear as it relates to this vaccine. And we need to be careful about things we might hear to the contrary.
Now, we're coming into the fall time, which means first kids are back in school. What should parents do to help protect their children who can't be vaccinated from spreading COVID? And that means also flu will be soon behind. So what should we do first as adults and as well as parents of kids do?
Right. So, you know what my first answer is going to be, right? It's vaccinate all the people around those kids who can be vaccinated. I'm a huge fan for mandating the vaccine because we've struggled so much. But if you think about it in the context of a school system, and a lot of the outbreaks in some of the school systems, particularly even the younger children, so grade school age, are the cases in those kids are introduced by some older individuals in the school system who are unvaccinated. That to me is that shouldn't happen. So whether it's the support staff, whether it's the teachers, or whether it's the kids over 12, if we have experiences, which we do, in which they have introduced the infection to the grade schools, that's something we could have avoided. And for us to not avoid that as a consequence of the absence of vaccine is really, to me, the biggest challenge. We have to get all the people in the school system that can be vaccinated until the vaccine is approved in the under 12-year age group. So that's really the first and most important principle of that. The second is that we do unfortunately need to use the other protection mechanisms that we talked about. One, wear a mask. We don't have a choice because we have a group of individuals that are unvaccinated and we need to protect them. And as we just talked about moments ago, even if you're vaccinated, you could have a mild scratchy throat and you could transmit it. Now, that's the second point. If you got a mild scratchy throat, what are you doing in the school system? Be home. So number one, get vaccinated if you can be. Number two, wear a mask. Number three, if someone's sick, your kid's sick, got a scratch, Mom, I feel a sore throat. Don't send them to school. Don't give them a glass of orange juice and send them to school. Keep them home. So vaccine, wear a mask, when sick, stay home, watch your space. The school systems need to be looking at ventilation and thinking about how the rooms are structured. I think those are really important things. And a lot of them are doing great work at addressing their ventilation issues and their space. Like I said, is not just about distance. And then just encourage good hand hygiene, although, clean hands is never wrong. The predominant mode of transmission of COVID is not by the hands. It really is by the space, by the ventilation, and breathing on each other.
Which again shows us why the masks are so important.
Correct. Right.
And that even though it's hard to keep the little kids in masks, it's better to keep them in masks and avoid them picking up COVID than having to worry about them getting the COVID.
Yeah, it's the best that we've got until we can get the vaccines for these kids. And so that's the best that we're going to do. So all we can do is the best we can do, given the limits, recognizing that challenge. What we can do better is get everybody in the school vaccinated.
And what we also have to learn is that this is a novel virus, which means every day we're getting new knowledge all the time. And what we said earlier is, again, when it first started in March and April, we didn't mask everyone up. There was a reason for it, that we needed healthcare workers to get the masks. And therefore, every day when there's a slight change in some of the guidelines, people need to understand the guidelines change based on what this virus is doing in the environment. It's not. It's not that we're making mistakes. It's not that we're changing our thoughts. It's that something happened. We learned something new. A new study came out, and we're using the results of that to change what we're currently saying.
Yeah, it's such an important principle that somehow gets lost sometimes in our messaging, that you're changing your mind, you're changing what you said. And I think you're right, spot on the mark, is that I've likened it to drinking from a fire hydrant at times. The information is just coming at you because it is novel and there's huge volumes of patients. We all want to do the best that we can, and we have to adapt. And if we don't adapt, that's a problem.
The other thing is that you've trusted your doctors up until this point for your blood pressure, your diabetes, checking you out, doing physicals on you. When they give you advice, their advice is usually much better than the advice you find on the internet or on Twitter or on Facebook. You've trusted them with your life up until then. Trust what they say to you about the COVID virus.
Yeah. I think that you have to do that, and it's interesting that you point that out. I think it was the AMA, but if you look at the vaccine uptake in physicians, it's close to 98%. And who knows what that 2% means, but essentially it's universal in the physicians across the country. Man, that speaks volumes about it. I mean, why would we be doing that to ourselves?
Now, with 1 minute left on this meeting, what are your thoughts for the audience? Tell us one or two thoughts just to remind the audience the importance.
The first thing is clearly that we need to get vaccinated. It's something important for all of us to do to protect ourselves, our family, our communities, and it's really safe. And the second would be the last thing you and I were discussing. Remember that you have to be suspect of sources of information that are not reliable. Seek out reliable sources. Your physicians, are good sources of information, your local health systems, and just be suspect of something that is not consistent with what your physician is saying.
Thank you, Dr. Nahass, for everything that you do. Thank you for all of the information you've given the studio audience. Thank you for everything you do for RWJBarnabas Rutgers Health Center. And thank you for being the word of wisdom out there.
Thanks a lot, Doug. Appreciate it.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about COVID-19, please visit our website at www.rwjbh.org/Somerset.